Everyone. This video will be a quick overview of the workflow for violent patient documentation. This is the newest update in Cerner regarding violent patient documentation. The goal for this is the creation of a notification method, a notification warning for Cerner users regarding a patient or a patient family behavior with a focus on violent behavior. Another goal is to allow the user to accurately document violent behavior in Cerner along with charting alerts and new areas of documentation that will signal, that will alert uh, ongoings with a particular patient or patient family. Once it's been determined that behavior has caused a reason for charting, the user, anybody who has access to Cerner, whether it's nursing or ancillary, uh, should complete that violent behavior risk assessment power form. And this is located in the ad hoc folder. Demonstrating this from Care Compass, selecting the patient and then selecting the ad hoc folder opens up the ad hoc segments. This is located within the nursing documentation segment, and you can select violent behavior risk assessment and click on chart. So this opens up the power form, and basically the power form is charting in Cerner that has logic built into it that will create a new task. Something will come from the charting once the power form is saved, depending on what is entered. So we will demonstrate violent behavior from family member of a patient. Violent behavior displayed by indicating I will select father, and this opens up risk flags by other persons. I'll select verbally aggressive here. There is a segment here that allows for free text. And then once the details are entered, the power form is saved. I will refresh so that the notification is now viewable. Once you click on a notification, you can review the alert here. The risk warning will indicate verbal aggression displayed by father of this patient. So this is all secondary to what is entered initially on that power form. If you recall, there's a few different uh, violent types and individuals that will filter into this area here, depending on what charting is entered into that power form. Now going back into ad hoc and reviewing violent risk assessment power form again, now we're going to document against patient. When patient is selected, you'll now notice that patient risk flags is enabled here. So documenting into these risk flags directed towards the patient will cause a couple of things to occur. The first would be a dynamic appraisals of situational aggression assessments, known as DASA. I'll put a couple of areas here, verbal aggression. And again, here, there's a free text area. And I'll go ahead and save the power form as is. I'll go ahead and refresh this segment here. I'll close the chart. So now you'll see the DASA is outstanding. And once the DSA is opened, the nurse will fill out the questionnaires depending on the current status of this patient. And I will indicate ones for these questions just to demonstrate a high risk. And I'll save this here. I'll close and refresh. Now, the DASA task will populate every 24 hours, and the Smart Zone alerts will populate based on the latest DASA charting. So if there's changes in patient behavior and it's documented within the DASA and the risk score decreases, it may remove the Smart Zone alerts. We'll go back into the patient chart here so that we can review latest Smart Zone alert. And you can see that the DASA screening results as a high risk of aggression. The risk of aggression are in two areas. Moderate risk is between 2 and 3 points, and high risk is equal to or greater than 4 points. And again, they will indicate here as moderate or high risk. Now, going back to the ad hoc charting and selecting the risk assessment here, and now documenting against patient, indicating a risk factor. Again, I'll use verbal aggressive. Free text notes if needed. Now, the inclusion of altercation is going to open up a new documentation segment, a new power form, violent altercation with staff. Now, in this segment, you would enter mode of the altercation. Now, go ahead and click on this one here. And if there was an intervention, you can document in this segment. If someone was notified of the altercation, you can enter here. And it does require you to enter altercation details here. Not just enter some sample text there. And down here, you can see a history of the altercation. The different areas that have been charted up to this point, if there's any, will appear here with a date that correlates next to that segment there. I'll go ahead and save this power form here. So now this will do a couple of different items. This will create a violence precautions alert for any clinician that opens up the chart. So this alert will display for nursing once every 12 hours. And for providers, medical providers will be once every 8 hours. And nursing and ancillary are the same every 12 hours for that nurse to open this patient chart. Let me refresh here, and then you will now see that alert pop up. This is secondary to the altercation details charting. You see this violent precautions warning that comes up here. And there's some details here, and it includes the particular setting that you chose regarding the altercation type. So now you will see that individual nurse or ancillary that is opening this patient chart after the altercation details are charted. They will get this one time, essentially per shift. You'll hit OK to enter that chart. And again, here, notifications will remain. Another thing that the altercation details will now include is violence precautions will now be noted on the upper banner bar under account number. You can see this area here indicates that this patient now has violent precautions as part of his visit here. Now, organizer icons will also populate within Care Compass and ED Launch Point. Let me demonstrate this. I will close this patient chart here. We'll refresh our Care Compass, and you can see you now have an alert for the violence precautions. And for ED Launch Point, it's very similar icon that will appear next to that patient name that kind of highlights the situation ongoing with this patient, secondary to that new documentation. It's also good to mention if a patient with a history of altercation within the past 2 years re-register, the Smart Zone alert, which will be these alerts here, the banner bar alert, which is here, and those organizer icons, again, out here, or in ED launch point, they will all reappear immediately. And this is again for anybody who had history of altercation documented within the past 2 years of the visit. There will also be a task for violence assessment that will be fired in Cerner for nursing to complete. In addition to this, any history of moderate or high risk of aggression documented along with that altercation piece for the past 6 months will automatically create a new task to assess via the DASA. So the hope is that all these items will increase awareness and create a good notification method for those who are going to be utilizing Cerner, and with patients that have violent history, um, or patient family members that have violent history, as a way for us to be alerted, for us to be aware of what the situation can be potentially, and allow us to continue with the workflow, with the normal nursing or ancillary workflow or provider workflow in a way that is safer for everyone. I hope this workflow will help your and guide you and your staff in what will be expected in this new documentation process. And as always, please reach out to me with any questions, comments, or concerns. Thank you.